whoever is having close contact with the baby is not sick because doon magkakaroon ng rashes yung bata.
No, don't blame the chicken. You can eat all the chicken in the world for as long as it's cooked. Hindi natin napapansin. We do not realize that the longer that we make use of the same product, later on yung balat nagkakaroon na ng allergic reaction.
Good morning, everyone. I'm Dr. Maria Victoria Tizon, and I am here this morning to answer your questions concerning baby skincare. The difference between baby skin and adult skin, well, when we look at them, initially we think that pareho lang yon, infant, that of an adult. Pero physically or structurally, ibang-iba. Considering that the infant skin, the moment the child is born, is immature and it takes almost 1 year to fully develop as mature compared to that of an adult. So kung titignan natin ano ang nangyayari sa baby skin. One, the baby skin is thinner compared to that of an adult. Siguro mga about 30% thinner. So, kung thinner ang balat ng bata, ng infant, or a newborn, ibig sabihin, lahat ng mga structures na nasa loob ng balat na yan ay immature as well. So, kung immature ang mga structures na nasa balat ng infant, function-wise, hindi rin kasing lakas compared to that of an adult. So, yun ang pag-iisipan natin, yun ang pinaka-basic na dapat alam nating lahat na unang-una, ang balat ng infant hindi tulad nating mga adults. And having that in mind, ngayon pag-isipan natin ng mas mabuti, papaano ngayon natin aalagaan ang balat ng ating mga anak, lalo na ang mga babies. So, tulad ng sinabi ko, mas manipis ang balat ng infant, ng baby, compared to that of an adult. So, kung titignan natin, whatever gamitin ng bata, ng infant, pupunta yan sa balat at lingap sa kaalaman ng marami. Akala nila walang lumulusot dyan sa balat na yan. On the contrary, yan ang mas delikado. Maraming mga produkto, mga chemicals na pwedeng lumusot sa balat ng immature skin, which is that of a baby, compared to that of an adult. Having said that, ibig sabihin ngayon, hindi maganda, hindi ibig sabihin na kung anong ginagamit ng mga adults, pwede din gamitin ng mga infants or safe gamitin sa mga infants. Yon ang ating dapat pag-isipan kung ano ang mga karapat-dapat na ginagamit sa balat ng bata or papaano alagaan ang balat ng bata. You can, but if we will look at the recommendations by the Department of Health, ang ating DOH, within 24 hours, pwede nang paliguan ng bata. Otherwise, kapag bagong silang ang bata, there is a big advantage of leaving the vernix on the skin of the child because it is on its own, that is naturally protective to the child. So, iiwanan yun sa balat ng bata and then just let it peel off on its own in the hours or days to come. But otherwise, ang recommendation dyan, within 24 hours, pwede nang paliguan yung bata. Once a day, okay na yon, pwede na. Or even 3 times a week. Bakit may differences? Tignan natin yung klima natin. Mainit dito sa Pilipinas. Ngayon, kapag sa init na yan ay pinagpapawisan ang bata, nakakaginhawa kapag napapaliguan natin ang bata at nawawash off ang mga unwanted bacteria or yung mga harmful bacteria. Tsaka yung mga dirt. Maraming pinanggagalingan ng dirt. But otherwise, kung maganda ang klima natin, okay na 3 times a week paliguan. Pero again, sa init dito sa Pilipinas, mas maganda once a day, every day paliguan ang anak. Alright, the best way, again, aside from using warm water, you also use a soft cloth. So, alam na natin kung paano natin kinakarga yung infant when we're using a tub or a basin. So, you have to secure the child. You can use a very soft cloth to gently wipe the body and especially the private areas. And then when you go to the face, you can use a soft cloth or cotton to wipe the eyes, especially from the middle part of the eyes going away from towards the sides of the face. So that's the proper way of bathing the child. You have to remember that the products, soap, shampoo, lotions, it has to be gentle, and also we think of which company created those products, because we have to go for those products produced or made or created by a very reputable company. So having said that, we have to also look at the background of a company just like Johnson's, and because they always base their products and their recommendations based on clinical studies, scientific studies, and so that is why they are confident to giving these recommendations, the products that they have for use for infants. So it has to be gentle and not containing harmful ingredients or materials. When it comes to looking at choices of baby products, we see a lot of those lined up in the grocery, the department stores, or kiosks, and we are given a lot of choices, a lot of options. The question now is, which one to pick? The answer to that is you have to look carefully. For number one, sure, you say that it's safe for babies, and then you tend to look at those that indicate clinically tested, and then it stops there. But if it says clinically tested, any product can be clinically tested, but it does not categorically state that it is proven safe. It can be clinically tested, but you have no idea that there are ingredients there that can be toxic to the child. So it's best that you see clinically tested and proven safe for use on infants. That's one. Two, I would fall back to, well, if the product or whatever is going to be used by the consumer, and of course the consumer is us, the patients also. We are the consumers, the end users, the patients. We want to make sure that whoever produced or manufactured the product is a reputable company. It's a reputable outfit, because they have to make sure that whatever they are producing has to meet in the international standards. It has to stick to principles that is internationally acceptable. Because at the end of the day, again, it's the safety of the consumers that they are after. And aside from clinically tested, also indicates proven safe, because when they indicate that it is proven safe, they have clinical studies to back up that statement. So, safe to say, Johnson's they have their own clinical studies, and they are evidence-based. So I would say that again, you have to look at who is manufacturing the product. All right, when it comes to incorporating ingredients or items in the bath of a child, yes, moisturizers or emollients or oils, simple oils, would also be good to incorporate during or after bathing a child. But not all moisturizers or emollients are safe to be used on infants, because there are a lot of products out there or items that are proven to be allergenic or are sensitizers in the bath products or the ingredient alone. Right, mineral oil or baby oil, you can use that, but there are some oils just like tea tree oil, olive oil. We were made to think that they are safe. They are, again, organic or natural, but it has already been clinically proven. There is evidence that these kinds of oils create a break in the skin. Again, we have to be careful of what kind of oils we use on our babies. Problem with ingredients like menthol as well. Mentholated products are not ideal because they are sensitizers. Nag-i-irritate sila ng balat. They create an irritation. So, unang-una, iniisip natin, maganda ang mentholated kasi pinapalamig ang balat ng child. But not only the child, pati adult. But hindi natin napapansin, we do not realize that the longer that we make use of the same product, later on yung balat nagkakaroon na ng allergic reaction. Nagkakaroon na ng irritation. It gets red, namumula, nangangate. Makikita nyo later on, nagiging dry, nagiging tuyot, makate, nagkakasugat na. So, now you see na nagkakaroon ng irritation, and it's because of the presence of sensitizers just like mentholated products. So, yun ding mga sinasabing mga pagpahid ng alcanforado or aceite de manzanilla. Although sinabi sa atin ng ating mga ninuno, our grandparents, ating mga nakakatanda sa atin, maganda yan para hindi kabagin ang bata. Pero ang problema dyan, mayroon ding mga ingredients dyan sa mga alcanforado or aceite de manzanilla na nakakapag-irritate sa balat ng bata. At hindi lang yon. Babalikan natin yung sinabi ko kanina na sa immature na balat ng bata, may mga ingredients diyan sa mga alcanforado or aceite de manzanilla na malaki ang potential na pumasok sa sistema ng bata because these ingredients will get absorbed by the skin and may get into the system of the child and might have some toxic effects. Yung tinatawag na baby acne, yan yung sa amin are one of the physiological changes that we can possibly see in infants. Because yung hormones ng mother na ililipat sa bata when the child is born, and imagine na ito yung tinatawag na mini puberty. Or imagine that your adolescent child has been transported back to being an infant. So, yes, acne can be seen in infants or even neonates. So, is that a form of an irritation? No, it's not. Maybe again, it's one of the possible common physiological changes that we see in an infant. But however, if you use products that can potentially create an irritation on the skin of an infant, especially on the face, it is possible that you can see pimple-like rashes on the face of the child. The seborrheic dermatitis or the cradle cap, that's another common problems we see in infants. it's not an irritation coming from a used product, but simply because there is a normal microorganism that's on the skin of the baby or the infant that acts on the activity of the oil glands of the child. Yung oil glands kasi natin, active yan in stages of our lives. Commonly alam natin when we are teenagers or adolescents, our oil glands are active. But unknowing to a lot of people, the oil glands are active when we are born until about a little bit past 10 months of age. So, yung normal microorganism na nasa skin natin reacts to the activity of the oil gland. And dyan natin nakikita that there are infants that has seborrheic dermatitis, which is commonly known as the cradle cap. Pero makikita rin natin ang rashes ng seborrheic dermatitis on other areas of the body. But now if we're talking of the real skin problem that we can potentially see, which are red flags, of course, when we see the skin turning red and irritated, meaning it's red, it's nagkakaliskis, it's scaling, nagkakaroon ng sugat-sugat, nagkakaroon ng mga may nana, syempre red flag na yon. Nagkakaroon na ng iritasyon na may kasama pang infection. But wag nating antayin na makita yung red flag na yan. The fact na makita mo lamang from the get-go na tuyot ang balat ng bata, nakikita mo na makaliskis, that itself already is the starting red flag of a skin that will become a full-blown problem. If we see now the baby acne or seborrheic dermatitis or rashes on an infant that are considered as common physiological changes on the skin level on an infant, no, I will not wait for it to resolve, because if it is left unattended, may potential na magkaroon ng escalating problem. Because as it is, kapag nag-uumpisa na yung changes in the skin, that is becoming red, scaly, mayroon ding dapat gawin na may papahid or baka may change in the skincare that should be reviewed, because the family may be doing something that is not advised. So what we are avoiding here now is that to become a full-blown problem. So it's best that the moment they see these changes, consult agad your doctor, whether it's your pediatrician, your dermatologist, or your pediatric dermatologist. So that is the advice, because that is the best advice we could give, so that we will not encounter bigger problems that would be difficult to handle medically. Now we're talking of chicken skin. The parents, I'm not surprised. It's a big issue because the skin is not smooth. It seems like, yun nga, it looks like yung binalatan na manok or plucked chicken skin. The problem here is, of course, every family wants their child's skin to be flawless, to be very smooth. So initially what they do is they do everything under the sun to hopefully address that chicken skin so that it will become smooth. But that's where we get the problems, because now those topicals that they are putting on the child are the topicals that were advised by their grandparents or their neighbors or whoever's advising them to put on the child, but little do they know that it's creating more problems than good. That's one. Two, chicken skin is a form of all right, allow me to use the word skin asthma, or better yet, atopy. So now we have to realize that chicken skin appearance on a child or even an adult is, well, it will stay there for quite a while. So we have to accept the fact that no topical medication will be able to smoothen out that chicken skin looking appearance on a baby or your toddler or your kid. So it's best that we leave that chicken skin looking appearance on your baby. The most important thing is, one, you don't see that it's getting red or namumula, and more importantly, hindi nangangati yung bata. So, as long as your baby or your kid is healthy in all aspects, that chicken skin on your healthy baby is okay. By the way, the chicken skin, it's not about eating the chicken. No, the poor chicken has nothing to do with it. It has something to do with the genes that was passed on from mom or dad. So, will I blame mom and dad? No, don't blame them. That's what you call, at least they got good genes. Don't blame the chicken. They can eat all the chicken in the world for as long as it's cooked. The bungang araw has to be addressed because it's broken down skin, nagkakamot yung bata. And not only bata, pati matanda, kakamutin. And once you do that scratching, may potential na magkaroon ng skin infection. Tignan natin yung nangyayari ang very common situation na nababalitaan natin sa news. Sa mga preso. Diba kada summer or yung mga tag-init, lagi nating naririnig na nagkakaroon sila ng mga pigsa, abscess, furunculosis, folliculitis. So, ang isang pwedeng pag-umpisahan yan is the heat rash. So, kapag magkaroon na ng complications of unmanaged or mismanaged heat rash, yung infection na yan from a simple pigsa can become life-threatening. Kasi nandoon yung microorganism, yung staphylococcus. So kapag hindi makontrol ng natural defense system ng bata yung staphylococcus na yan, from the balat, pwedeng magpunta sa bloodstream. And dyan na mag-uumpisa na nagkakaroon ng infection na makikita ring nilalagnat na yung bata, nawawala na ng ganang kumain yung bata. So, it's best that ang inaakala nating simple heat rash, dapat pagtuunan ng pansin yan. Kisses. It's a manifestation of our love for another very dear to us, and of course, our kids, our parents. So, is it okay to kiss a kid, especially a baby? Why not? Sure. But the stubbles, no, the stubbles are not going to create a skin rash on the child. The poor fathers laging at the receiving blaming end of the why the child has rashes. But what I will be more careful about is, syempre, make sure lamang kung sino humahalik sa bata, walang sakit, like cough or colds, that's one. Two, lalo na sa mga kalaro, sa mga other kids in the house, make sure na walang skin infection din yung na humahalik sa bata. Whoever is having close contact with the baby is not sick because doon magkakaroon ng rashes yung bata. From contracting it from another person in the house that has a transmissible skin infection, a bacterial infection at that. But stubbles, no.
We want the best for our children. And sometimes, nagiging over the top. Gusto mo yung pampaligo ng bata is filtered water, bottled water, mineral water. No. plain tap water is fine. You don't have to use those ordered, delivered bottled waters to your home, and you're going to use gallons and gallons of those for your child. But we do understand that there are areas wherein they have poso negro. So yung mga na yun, yung yung deep well. Thank you, deep well. They contain a lot of mineral elements na truly nakaka-irritate. But otherwise, that's why may mga soap products or cleansers that will balance off the hard water. Harsh, hard water. Yung hard water, maraming minerals yan, especially calcium and magnesium. But at least the cleansers are there to compensate for the irritating effects of this hard water. So, no, again, let's not complicate our lives. Ang mahal-mahal din kapag pa-deliver ng mga bottled waters na yan. All you have to go for are the good cleansers that are truly meant to be used on your skin, and especially that infant skin. Breast milk, I'm not too keen on advocating that, applying breast milk on the rashes of the child. If the child or any patient for that matter develops a rash, it's best that you go to a healthcare provider, your doctor, whether it is a family practice physician, your general practitioner, or more especially your pediatrician or your pediatric dermatologist. It is best to be attended to by the doctor. So go first to your pediatrician. If you have access to a dermatologist or a pediatric dermatologist, then we would advise that you consult, the sooner the better. One, of course, bathing. Bathing is important because that is the time that we are able to bond with the infant. There's this psychological bond that occurs as well. But bathing also means you are removing the impurities that's already on that skin, because it's the impurities that can potentially trigger off or create a rash. So the impurities also mean the bacteria. Now, if I'm going to make an example out of the diaper area, yung pagpupo ng bata, take note of yung mga pupo, the fecal particles. Water alone cannot remove yung mga impurities, or in general term, dirt. We need cleansers to carry the dirt away from the skin of any person, for that matter, more especially the infant, the baby, the child. So, if I will make an example out of the diaper area, one of the dirtiest ever, can you imagine yung mga poop particles or the fecal particles naka-insert in between the crevices of that bottom? So, the water alone cannot take them out. We need the cleansers to effectively carry out that unwanted dirt from the crevices, even the very minor crevices of the skin. So, one, we need water. Two, we need cleansers. And then, after gently bathing the child, we have to completely, thoroughly towel dry the child. And then it is also advisable that you moisturize the child or maglagay ng moisturizer or emollient after bathing. Why is the moisturizing aspect important? Remember again that pagkaligo ng bata, that child is exposed to all elements that can break down that skin again. So that the changes in the skin can be affected by various external
factors. What are those external factors? One, the aircon. Kapag malamig na malamig ang environment, there is low humidity na pwedeng mag-dry out ng skin ng bata or the child or the baby. Two, this heat alone. Kapag pawisan ang bata, yung pawis alone can irritate the skin as well. And what can repair this breakdown of the skin? Moisturization. To moisturize the skin is advisable as a general part of the general skincare of the baby, of the infant, of the child, and even that of an adult. The parents or the caretakers or the caregivers, all of us deserve this kind of skincare. Okay, when it comes to the dark marks, scars, or what in Tagalog we call it peklat, post-inflammatory hyperpigmentation, keep in mind na kapag ang balat magkaroon ng pamumula, lalo na sa Asian skin and Filipino skin, we have to keep in mind, majority ng mga Filipinos, dark ang balat. Coming from our Malaysian, Indonesian race, the fact of the matter is we are a darkly pigmented race. Now, it is natural, it is normal, it is physiological na pagkatapos magkaroon ng pamumula or rashes ang balat, natural reaction, mamumuti ng konti or magkakaroon ng itim na peklat. I'm the type of the dermatologist that does not recommend using whitening products. I always tell the mothers or any caretaker or the grandparents, huwag kayong mag-alala. Nature or God has its own medicine. Having said that, ang ibig kong sabihin, don't worry, yung balat na yan, slowly mawawala ang pangingitim, yung peklat. I will make a personal experience here. You're looking at a patintero queen. Someone who has suffered from all the dapa, the sugat, name it, peklat at all, nawala yung peklat. So, do not worry about those dark spots, the peklat, they will go away. But iba ang usapan, kapag malalim na malalim yung sugat, yes, then there can be scars, lalo na kung sa tuhod. Don't worry about them as well. Whatever happens, huwag kayong magpapahid ng kung ano-anong mga topicals na nasa market dahil yun ang sinabi ng kapitbahay nyo, yun ang sinabi ng inyong mga kaibigan. Don't. Hindi nyo alam na may mga ingredients at hindi nakasaad yan sa label ano ang nilalaman ng topical na yan. Dalhin nyo sa doktor yung anak nyo. Magko-comment or magbibigay ng tamang advice ang doktor ko anong gagawin doon sa mga scars na yon. Now, when it comes sa pampaputi, I am also an advocate of brown skin is absolutely beautiful. I am the type of dermatologist, especially pediatric dermatologist, bakit tayo nagpapaputi? Now, if we're going to bring this now to the level of an infant, bakit kayo magpapahid ng pampaputi sa isang sanggol? Tandaan natin na ang balat ng sanggol, immature yan. At kahit ano pa mangyari, kung ano ang ipinapahid sa balat, malaki ang potensyal na kung ano man ang ingredient na hindi po pwede, hindi akma sa balat or sa katawan ng maski sino mang tao, it can be toxic. Toxic, ibig sabihin, pwedeng ikakamatay ng tao. Mag-ingat tayo. Bakit ko nasabing pwedeng ikamatay? May mga whitening agents na kapag iyan ay napahid sa balat, yung whitening agent na yan, lulusot sa balat, pupunta sa sistema, sa dugo, sa sirkulasyon ng tao, and syempre kasama na dyan yung bata. And that very dangerous, toxic ingredient will go to the kidneys. Tandaan natin ang ating kidneys or bato is one of the processing factories to remove the toxins of our body. Pero kapag yung ingredient na yan nakakasira ng organ, the kidney at that, pwedeng magkaroon ng kidney failure. At yun ang ikamamatay ng pasyente. So, iuuwi ko sa tanong na ito, bakit nyo gustong ipaputi ang anak ninyo? Yan ang binigay ng Diyos, yan ang magandang regalo na binigay sa atin ng Diyos. At yan din ang pagkaitim natin ang nagpoprotekta sa atin sa dangerous effects ng ultraviolet rays. Tandaan ninyo, mataas ang skin cancer incidence sa Australia at sa Europa. Dahil sila, ang balat nila, kukuonte or hindi gaano kadami ang protective mechanism ng balat nila para isanggain ang harmful effects ng ultraviolet rays. Pero bottom line, pagkadating sa kagandahan ng individual ng tao, brown skin is beautiful. Do not put any whitening agent on your child. Do not use any whitening soap or agent on your infant. Bibigyan ng atensyon na magsasabi sa atin, kailangan natin pumunta sa doktor, lalo na ang pediatrician. Kapag nakikita natin yung anak natin, anything that makes us uncomfortable, punta na sa doktor. Anything that looks abnormal, pumunta na sa doktor. Yun ang aking mga tips na kailangan na maisip nyo na hindi ko to kaya, ayaw kong mag-try ng kung ano-ano muna, tatry ko na wag mo nang dalhin sa doktor, baka kaya ko to. Pero naisip nyo ba, baka yung pinapahid ninyo sa anak ninyo ay hindi akma sa balat ng bata. So, it's strongly advised, I highly advise that if you see anything that is out of the normal, dalhin nyo na agad sa doktor, sa pediatrician, sa general practitioner ninyo, sa family practice physician, or especially the pediatric dermatologist. To wrap this thing up, infants, children are not mini adults. Hindi sila tulad natin. Kailangan natin maintindihan na may mga parte ng katawan at lalo na yung balat na hindi katulad ng sa mga adults. Pangalawa, we have to understand already, sa dami na nandyan sa market, sa dami na nandyan sa grocery, sa dami ng ipinapakita sa media, TV, radio, print, or even lalo na online. Maging critical tayo sa nakikita natin, sa naririnig natin. Sa panahon ngayon na it's very easy to access information, dapat natin alamin ano ba ang nilalaman niyang produkto na yan, ng gamot na yan, saan galing yung gamot na yan, sino ang gumawa ng gamot or ng produkto na yan. Because at the end of the day, ang ating health ang ating bantayan. Lalo na ang health ng mga bata at ng mga infants. Because ayaw natin na grumabe ang isang what seemed to be simple at first, kailangan hindi natin maging malala ang sitwasyon. So, we can prevent a condition from worsening. We can prevent an illness from happening. That starts with proper skin care and knowing, being properly informed what we are using on our children. Again, I am Dr. Maria Victoria Dizon, and it was a great pleasure to have addressed your queries.